For 50 years, doctors have told you the same thing. 120/80 is perfect. The lower, the better. If you are over 70, that advice might be the very thing pushing you toward a broken hip, a nursing home, or a faster decline in your brain. In the last few years, large studies on older adults have revealed something deeply uncomfortable. Seniors whose blood pressure is pushed too low are more likely to fall, fracture a bone, lose independence, and in some cases, die sooner than people with slightly higher numbers. Today, I'm going to show you the blood pressure range that actually keeps your brain awake, your legs steady, and your body off the floor, and why 120/80 can be dangerous after a certain age. But I am not giving you the exact target number yet. If I blurt it out in the first minute, many people will scribble it down, change their medication, and click away, and some of those people will get hurt. You don't just need a number, you need to understand when perfect blood pressure becomes poison for seniors. So stay with me. If you've ever felt dizzy when you stand up or you're terrified of falling, this might be the most important video you watch this year. Let me introduce you to Marie. When I met her, she was 79. She lived alone in the little brick house she'd shared with her husband for 40 years. She still drove herself to church on Sundays, kept a vegetable garden, and walked her dog every afternoon. 10 years earlier, her blood pressure had been 155/90. Her doctor did what doctors are trained to do. He started medication. Over the years, every time Marie's pressure was still above 140, he increased the dose or added another pill. Eventually, they hit the magic number, 118/76. Her doctor smiled, patted her chart, and said the line many of you have heard. "Beautiful. That's textbook. You're protected now." At first, Marie was proud of that number. She told her friends at church, "My doctor says I have a teenager's blood pressure." Then, little things started to creep in. When she stood up from the couch, the room would tilt for a second. In the kitchen, she found herself gripping the countertop while her vision blurred at the edges. She told herself it was just age. At her next visit, she mentioned it. Her doctor glanced at the numbers, 116/74. "Your blood pressure looks great," he said. "Just stand up more slowly and drink more water." So she did. She began to move like someone walking on thin ice, cautiously, always bracing herself on furniture. Her daughter noticed. "Mom, why are you walking like you're afraid you'll break?" Marie laughed it off, but inside, she was afraid. She just didn't have the words for why. 3 months after hitting that perfect 118/76, it happened. It was a Tuesday morning. Her dog barked to go out. Marie swung her legs over the side of the bed and stood up. The world didn't just tilt this time, it vanished. She remembers a violent rush in her head, her knees turning to paper, her hand reaching for the nightstand and grabbing nothing but air. Then the sickening crack of bone on hardwood. When she opened her eyes, she was on the floor, her right leg twisted at an angle legs are not meant to bend. The dog was barking frantically. The clock on the dresser read 6:12 a.m. Marie's neighbor heard the dog and found her an hour later. The paramedics checked her blood pressure, lying down 112/70, sitting 92/60, trying to stand 78/52. Her pressure was collapsing every time she changed position. That drop has a name, orthostatic hypotension, and in older adults, it is one of the fastest paths from independent at home to frail in a nursing home. X-rays showed a shattered hip. She needed emergency surgery, metal plates, screws, weeks of rehab. But the real damage wasn't just to the bone. Before the fall, Marie walked her dog, cooked her own meals, and climbed the church stairs every Sunday. After the fall, she needed help getting out of bed, getting to the toilet, even getting dressed. 6 months later, she was still using a walker and was terrified to be left alone. The house she had once ruled now felt like an obstacle course built to break her. And here's the part that should make you angry. That entire cascade, from dizziness to fall, to surgery, to permanent loss of independence, started not because her blood pressure was too high, but because someone insisted on making it perfect. 118/76 on paper. 78/52 when she stood up. The first number looked like success. The second number nearly took her life. So the real question isn't, what's the best blood pressure? It's, what blood pressure keeps an older adult on their feet with a clear brain and steady legs? That number is not the same as it is for a 40-year-old. And forcing seniors into the 120/80 box can be just as dangerous as leaving blood pressure uncontrolled. Before we go any further, I want to see what you're living with. Comment below with just two things, your age and your usual blood pressure. For example, 74/140/80 or 82/125/70. Seeing your numbers helps me tailor future videos for you. Let's talk about why Marie's beautiful number was actually dangerous and why 120/80 is not automatically the right target once you cross into your 70s and beyond. There are 4 big reasons, and if you understand them, you'll be able to look at your numbers with a lot more confidence. When you're 30, your arteries are like brand new garden hoses, soft and springy. Your heart squeezes, the hose expands, and blood flows easily. By the time you're 70 or 80, those hoses have been sitting in the sun for decades. They stiffen. That's called arterial stiffness, and it's normal aging. In younger adults, 120 systolic is usually enough pressure to push blood up to the brain, even when they stand quickly. In older adults with stiff arteries, that same 120 can be barely enough when lying flat, and not nearly enough the moment they stand. That's when blood pressure can suddenly drop, and the brain doesn't get what it needs. Dizziness, blackouts, falls. Your body has built-in pressure alarms called baroreceptors, little sensors in your blood vessels that notice when pressure drops and send an urgent message to the brain. Hey, stand by. We need the heart to beat faster and the vessels to tighten up. When you're younger, that system is lightning fast. You jump up from the couch, your body compensates instantly. With age, those alarms get sluggish. They still work, but not as quickly. So when an older adult stands up, pressure may drop before the body reacts. If their starting pressure is already low, that drop can be dramatic. That's orthostatic hypotension again, the silent thief of balance. The third problem is medication sensitivity. As we age, kidney and liver function often slow down. Many blood pressure medicines are cleared through those organs. The dose that's perfect for a 55-year-old can drive an 80-year-old's pressure dangerously low, especially when multiple drugs are stacked together. Studies in older adults show that aggressive blood pressure lowering can reduce strokes and heart attacks if people are monitored very carefully. But it also increases dizziness, fainting, and kidney problems in some seniors. In other words, the margin for error gets tiny. When you're 50, the main danger of high blood pressure is slow damage over decades, heart disease, kidney disease, stroke. When you're 80, you're still at risk for those things, but there's a new, more immediate killer. One bad fall. A meta-analysis of more than 49,000 older adults found that orthostatic hypotension, the kind of drop Marie had when she stood up, was associated with about a 70% higher risk of falls. Another large study linked hospitalizations for orthostatic hypotension with a markedly increased risk of fractures. A fall that breaks a hip can start a chain reaction: surgery, bed rest, muscle loss, infections, and permanent loss of independence. So at 80, the question isn't just, how do we avoid a stroke 10 years from now? It's, how do we avoid the fracture that could land you in a nursing home this year? That's why blindly chasing 120/80 in every senior is so risky. For some, it does reduce long-term risk. For others, especially those who are frail or on many medications, it can tip them into falls, hospital stays, and faster decline. If any of this sounds uncomfortably familiar, if you've been told your blood pressure looks great, but you feel worse, write "too low" in the comments so I know this is hitting home. Now, let's connect this to what major studies and guidelines actually say, and then we'll turn that into a range that protects both your heart and your balance. Over the last decade, several big trials and analyses looked at how low to push blood pressure in older adults. Many international guidelines now say that for most healthy adults over 65, aiming for a systolic below about 130 can reduce strokes and heart attacks if the person tolerates it well. A major 2025 analysis of patients 75 and older found that more intensive control, targets below 130, reduced cardiovascular events without a large increase in serious side effects in carefully monitored patients. But frailty changes the picture. Other research has shown that in frail seniors, people already weak, underweight, or with multiple serious illnesses, those with very low blood pressure sometimes had higher death rates than those with slightly higher numbers. In some cohorts, the safest systolic range in frail older adults appeared to be somewhere around 130 to 150, not below 120. We already talked about orthostatic hypertension and falls. Large reviews show a clear association between postural blood pressure drops and falls in older adults. That means a number that looks fine lying down may be dangerous once you stand. So how do we put this together? Here's the key idea I want burned into your brain. Your safest blood pressure in older age is not the lowest possible number. It's the number that keeps your brain clear, your kidneys happy, and your legs steady when you stand. That usually means avoiding very high pressures for too long because they damage arteries and organs. Avoiding very low pressures, especially with big drops when standing, because they steal blood from your brain and bones and throw you to the floor. Somewhere between those extremes is a safe function zone that depends on your age, your other medical problems, whether you're robust or frail, and whether your pressure crashes when you stand up. In a few minutes, I'll give you concrete ranges for different age and health groups. But first, you need to know how to find the hidden danger Marie had, because it almost never shows up in a quick office reading. You can do this at home with any decent blood pressure monitor. Here's how. Rest lying down. Lie flat for 5 minutes. Relax. Then take your blood pressure and write it down. Stand and measure. Stand up carefully. As soon as you're upright, take your blood pressure again while standing. Compare the numbers. If you're systolic, the top number drops by 20 points or more, or you're diastolic, the bottom number drops by about 10 points or more. That's called orthostatic hypertension. Example, lying 135/78. Standing 108/64. That's a 27-point drop on top. That's a problem, especially if you feel dizzy, foggy, or weak. Even if your lying down blood pressure looks like a perfect 120/80, a big drop when you stand means your brain is going hungry every time you get out of bed. That is exactly what sets people up for falls. If you have a monitor at home, pause this video later and do that test. When you've done it, come back and type "tested" in the comments so I know you're not just listening, you're actually checking your own body. Now let's talk numbers. I'm going to give you ranges, not rigid targets, for different groups of older adults. These are based on a blend of guideline suggestions and what multiple studies show about balancing stroke prevention with fall risk. Write them down, but remember, this is education, not personal medical advice. Your own doctor, who knows your full history, has the final say. If you're between 65 and 75, you're reasonably active, and you don't have major problems like heart failure, advanced kidney disease, or severe frailty, most modern guidelines are comfortable aiming for a systolic below about 130 if you tolerate it. But here's my functional twist. I'm usually happy with a systolic between about 120 and the mid-130s, as long as you don't have big drops when you stand, don't feel dizzy, weak, or foggy, and your diastolic, the bottom number, stays roughly above 65 to 70. If your doctor is pushing you to 118/72 but you can't stand up without grabbing the furniture, that's not a win. In people 75 to 85 who are still living independently, walking and managing their own lives, a slightly higher range is often safer. Many studies in older populations suggest that in this age group, systolic in roughly the low to mid-130s is a good compromise, low enough to reduce stroke risk, high enough to keep the brain and legs working. In practice, I'm often comfortable when systolic sits somewhere around 130 to 140, diastolic is around 70 to 85. There is no major drop when standing, and the person feels clear-headed and steady. If someone at 80 years old feels great at 135/80 with no standing drop, I am rarely excited about forcing them down to 118/72 just to satisfy a textbook. Once someone is over 85, or if they are frail at any age, thin, weak, multiple serious illnesses, the priority shifts even more toward preventing falls and preserving independence. In that group, many experts accept systolic readings in the 140s, sometimes even up to around 150, provided diastolic is not too low, ideally 70 or above. There is no huge standing drop, and the person isn't having symptoms of extremely high pressure, like headaches, chest pain, or shortness of breath. For a frail 88-year-old who gets dizzy at 125/70 but walks comfortably and thinks clearly at 145/80, I will choose 145/80 every single time. A fall will hurt them far sooner than a theoretical stroke in 10 years. If you have diabetes, previous stroke, heart disease, or significant kidney disease, many guidelines still encourage somewhat tighter control, often aiming for readings at or below around 130, again if you can tolerate that without dizziness, kidney injury or falls. In reality, that might mean aiming for roughly 125 to 135 systolic, watching your standing pressures closely and accepting slightly higher numbers if aggressive lowering makes you miserable or unsteady. The theme stays the same. The right number is the one that protects your heart and brain and lets you stand up without the world going black. Type in the comments which group you're in: 65 to 75 healthy, 75 to 85 independent, 85 plus or frail, or complicated, diabetes, heart, kidney. I read those to decide which videos to make next. Now that you understand why 120/80 can be too low for some seniors and where the safe function zone usually lies, here's exactly what to do next. For the next 2 weeks, check your blood pressure once in the morning and once in the evening. Write down the date, time, and numbers. Home readings are often more accurate than rushed office readings. At least twice during those 2 weeks, do the lying to standing test I described. Note any big drops. Circle them in your log. Pay attention to dizziness or lightheadedness when you stand, feeling foggy or exhausted, or new weakness in your legs. These can be signs your pressure is too low for you, even if the numbers look pretty. Ask yourself, how old am I? Am I robust and active or frail? Do I have diabetes, past stroke, heart disease, or advanced kidney issues? Then see which of the ranges we talked about most closely fits you. At your next appointment, bring your 2-week blood pressure log, the standing test results, and a note about any symptoms. And ask a very specific question. Given my age, my other conditions, and these standing drops, is our blood pressure target protecting me from strokes and from falls? Or are we chasing 120/80 just because that's what the chart says? If your doctor agrees that your pressure may be too low, any medication changes should be slow, one change at a time, checked with home readings, and re-evaluated if dizziness returns. Do not stop or cut pills on your own. The right blood pressure at 68 is not necessarily the right blood pressure at 88. Every 6 to 12 months, repeat the lying to standing test, a 2-week home log, and a conversation with your doctor about balancing stroke with fall prevention. Let's pull this together. For most healthy older adults, chasing the lowest possible number isn't the goal. In your later years, the safest range is usually where your brain is awake, your kidneys are happy, and your legs are steady, even if that means a systolic in the 130s or low 140s instead of 120. Orthostatic drops, big falls in pressure when you stand, are as important as the number you see lying down, because they are tightly linked to real falls and fractures. If this video helped you understand your own numbers better, do 3 things for me and for the seniors you care about. Comment one of 3 phrases, too low, if you suspect your pressure might be lower than is safe for you. About right, if you feel steady and your numbers fit the ranges we discussed. Talking to my doctor, if you're going to bring this to your next appointment. Share this with one person over 65 who is on blood pressure medication especially if they've mentioned dizziness or a recent fall. This information could literally keep them on their feet. Subscribe if you want more doctor-level explanations made specifically for seniors, not rushed clinic visits, not one-size-fits-all charts, but real conversations about how to stay sharp, steady, and independent as you age. Your goal isn't to have perfect numbers. Your goal is to stay standing, stay thinking, and stay living the life you care about. And for many seniors, that means learning that higher can be safer when it's the right kind of higher.